third-generation cephalosporin or a beta-lactamase inhibitor. In this instance, they treated her with Augmentin, which is a combination of the beta-lactamase inhibitor, clavulanic acid, and amoxicillin. She was on bed rest with bathroom privileges and acetaminophen every 4 hours as needed for elevated temperature and discomfort. The nursing summary indicates that she was taught about cross-infection and general health-related precautions, including the importance of good hand washing, proper disposal of used facial tissues, adequate rest, and increased calorie intake, plus how to avoid future respiratory infections, especially by getting annual influenza and pneumococcal immunizations. You'll want to ask how she is managing at home with her medications, review her medications, and also go over the signs and symptoms of respiratory infection. Put immunization reminders for influenza vaccine and Pneumovax on her chart for the appropriate times, and also log them into the computer so she will get a reminder postcard when it is time for her to get her shots. Asthma, also called reactive airway disease, is a chronic lung disease that causes the breathing passages to tighten and narrow, making it difficult for the person to breathe. Asthma affects more than 20 million Americans, and the incidence is rising. Each year, nearly 5,000 people die from this disease, with hospitalization and mortality rates higher among African American children. Asthma is characterized by recurring episodes of wheezing, shortness of breath, chest tightness, and cough. In most cases, these symptoms are reversible. Asthma risk factors. Inherent risk factors. Family history of asthma or allergies. Individual history of allergies. External risk factors. Exposure to secondhand smoke. Exposure to allergens such as pets. Exposure to air pollution. Viral respiratory infection in adults, exercise, stress. There are several lifestyle changes clients can make to prevent asthma attacks. Advise them to stop smoking and limit or eliminate their exposure to secondhand smoke. They should take measures to make their home environment allergen-free and either not have pets at all, or at least keep them out of the bedroom. As much as possible, they should keep their work environment allergen-free. Suggest that they use their home and vehicle air conditioning systems during allergy season, and that they stay indoors as much as possible on days when humidity or the pollen count is high. During an asthma episode, accompanying emotional stress can lengthen the attack, and, for children in particular, the breathing difficulty may worsen the emotional stress. Controlling the episode and stabilizing the breathing pattern will help decrease emotional stress. It is important to help adults and children develop effective coping mechanisms and relaxation techniques to help lessen their feelings of anxiety and panic. People who experience severe emotional reactions to asthma might benefit from professional counseling. For clients who experience exercise-induced asthma, or EIA, pre-exercise treatment with a short-acting beta-2 agonist, such as albuterol, 10 to 15 minutes before exercise will open the airways and help prevent an asthma attack. Asthma prevention. Step 2. Seek appropriate treatment. According to the National Asthma Education and Prevention Expert Panel, asthma management goals are to prevent troublesome symptoms, maintain normal lung function, prevent flare-ups and the need for emergency interventions, provide optimal medication therapy without major side effects, meet client and family expectations. What symptoms are common in an asthma episode? Tightness in the chest, difficulty breathing, wheezing when breathing, and coughing, especially at night or after exercise. An asthma diagnosis is based on a medical history and physical examination. During the exam, the practitioner will look for inflammation of nasal or sinus passages, excessive chest expansion during respiration, and the sounds and location of wheezing or forced exhalation. Remember, asthma is not so much a problem of breathing in as it is of breathing out. When the airways are clogged with mucus, Stale air gets trapped in the lower portions of the lungs, and the person must use the upper respiratory tract to gasp for air. To help confirm the diagnosis, the practitioner will also use various pulmonary function tests, such as forced expiratory volume, or FEV. Chest X-ray, serum IgE levels, which are elevated in response to allergens, and an exam of the nasal passages can also provide important diagnostic information. The National Asthma Education and Prevention Expert Panel recommends a 4-step approach to treating asthma. The first step is for mild intermittent asthma. The client takes a short-acting bronchodilator as needed, typically a beta-2 agonist like albuterol or terbutaline. The second step is for mild persistent asthma. The client uses a short-acting bronchodilator as needed, plus a daily low dose of an inhaled corticosteroid like beclomethasone, triamcinolone, or fluticasone. The third step is for moderate persistent asthma. The client takes a short-acting bronchodilator, plus a medium dose or a low to medium dose inhaled corticosteroid, plus a long-acting bronchodilator, such as an oral sustained-release form of albuterol. The fourth step is for severe persistent asthma, and it includes a short-acting bronchodilator, plus a high-dose inhaled corticosteroid, a long-acting bronchodilator, and an oral corticosteroid like prednisone. Role of medication: quick relief, long-term control. Many medications are used to treat asthma, the first of which are short-acting beta-2 agonists for quick relief. There are also inhaled corticosteroids for long-term symptom control, and oral corticosteroids for short-term relief of inadequately controlled asthma or long-term relief of severe asthma. Other medications include cromolyn sodium and netocromol, methylxanthines, leukotriene modifiers, and long-acting beta-2 agonists for long-term prevention of symptoms, especially at night. What should you include in a teaching plan for your clients who have asthma? Teach them about the disease, how to use an inhaler or a spacer, the role of medication in their treatment, and how to monitor asthma severity. In addition, you'll work with them to develop an asthma self-management plan, an action plan for asthma attacks, and environmental control measures. What is status asthmaticus? It's an acute exacerbation of asthma that is unresponsive to treatment with bronchodilators. It varies from mild to severe, with bronchospasm, airway